So my area of biosecurity or infection control is something I've been dealing with probably for close to 15 and 20 years, looking at various aspects, trying essentially to figure out better ways to prevent and treat infectious diseases, with a lot of emphasis on prevention as opposed to treatment, since prevention is really at the core of what we try to do. So a question about what is biosecurity in horse farms, and one of the questions I actually rephrase first is, do we actually do biosecurity in horses, or do we do infection control? Biosecurity really is trying to keep bugs from getting onto a farm. And we do that with chickens, we do that with pigs. We can't really do that with horses because we take them out to different shows and races, and they encounter other horses. So we're always doing things that let a horse bring something infectious back to the farm. And by the nature of what we do with horses, we have to do that. So what we do is infection control. We're trying to reduce the risk of problems that can come up just from what we normally do with horses. So infection control is there to reduce the risk and the occurrence of infectious diseases, but we know we can never 100% eliminate them. So our research program aims at taking it from the really basic level to the broad population level. So starting off with genes within bacteria or viruses, broadening that into what's going on in other aspects of the lab, but also taking that to the farm and taking that to the individual horse, the individual farm, and the horse population as a whole. So we're not focusing on one specific disease or one specific horse or one area. We're trying to get a better idea of what goes on in the whole population, taking an ecological approach to infection control to figure out what we can do at the individual bacterium, horse, farm, and community level to reduce disease transmission. So infectious diseases have been around for a long time, and they're always going to be around. And the risks for individual horses and individual farms are really going to vary depending on what they do, whether they have a closed herd where they don't really go anywhere, whether they have brood mares versus older horses, whether they go to shows and mix with a lot of horses. But we have some general themes that we see with infectious diseases. We have the diseases that are present in the horse population at all times, things that can live within a normal horse, a healthy horse, but cause disease given the right circumstances. And we also have infectious diseases that are transmitted between horses fairly widely in the population, something like equine influenza or something like strangles, where encountering a new horse that's carrying that infectious agent can cause disease in the animal or on the farm. Then we also have emerging issues, new diseases that might be coming up, might be uncommon but increasing of concern, diseases that might come out of nowhere and pose a risk to our horses. So emerging infectious diseases are always a concern, whether it's horses or people or any other species. It's something we have to pay attention to. The problem with emerging diseases is we don't know what's coming. We have a few different areas we pay attention to. We have current diseases that might change. Equine herpes virus is a good example of that, where in the past few years we're seeing a lot more outbreaks and a lot larger outbreaks because maybe of some changes within the virus. We also have the antibiotic-resistant bacteria that are becoming a big problem in horses, such as resistant staphylococci. Now, these are big problems in people, and now we're seeing that spread into horses, something that's building up over time. We also have infectious diseases that might be changing because of climate change, as we see warmer winters where we're not getting as many parasites killed in the environment, or we see changes in wildlife and ticks that can carry infectious disease. So as climate warms up, we can see diseases changing their range and moving into a new area. And then the other class of emerging disease is the truly emerging disease. West Nile virus, a great example. This obscure virus that was found in another continent that all of a sudden came in and wreaked havoc in North America. And we're always at risk of new emerging diseases that maybe occur somewhere else, or diseases that have never been identified before that come out of nowhere. So the Equine Guelph Equine Biosecurity e-sessions can be a great advantage for horse owners. It can raise awareness, which is the biggest thing. Too often we focus on infectious diseases when there's a problem, or when we're thinking about vaccination or deworming, but not in the broader context. And that's what these sessions are designed to do, is get people thinking in broad terms about infection control and the little easy, practical, day-to-day things that we can and should do to reduce the risk of problems. So increasing the awareness, identifying a few key points. If someone can go home from these with one or two take-home messages they can apply to their farm, they can probably have a big improvement in infection control.